the biggest gap and frustration, I think, with NetSuite customers in the past in healthcare is the inability to be able to do that revenue recognition, do your journal entry, manage your write-off period, and do it all within NetSuite and not have to do it in an Excel workbook.
Welcome to ERP on Tap, your steady flow of everything you want to know about NetSuite and Acumatica, the podcast where we dive into practical tips, expert insights, and real-world examples, exploring the tools, tips, and tricks you need to make your business processes flow like never before. Welcome to ERP on Tap. I'm Jonathan McKee, and this week we're going to be talking a little bit about the healthcare industry. And if you're in that industry, then navigating things like insurance billing, Medicaid, Medicare, or if you even know what RCM is, then you might know the name Optimed Tech because they've got a solution built for healthcare providers, payors, device suppliers, all that to streamline revenue cycle management directly in NetSuite. So this week, the topic is NetSuite. And if you know NetSuite, this is a native SuiteApp built right into the platform. And today on ERP on Tap, we get a chance to learn a little bit about this solution because we're interviewing a friend of mine, a guy here in my hometown, Bruce Capagli, CEO of Optimed Tech, empowering healthcare with data-driven solutions. Bruce, it's so good to have you on ERP on Tap, but welcome.
Thank you. How you doing today?
We're doing good, especially because we're talking with you. I'll tell you what, Bruce, you're a busy guy. Thanks for joining us. I'm hoping you're not always working. Tell me, what do you do when you're not working? What do you do for fun?
I love to ski, love to spend time with the kids, play basketball, swim in the pool, all that fun stuff. Family's important.
Oh, that's great. And skiing, okay, since you're actually in my hometown, right here at the base of the Sierra Mountains,
Yes,
let me
sir.
ask you, where do you ski? If you go skiing, where do you go?
I'm a big Kirkwood guy. That's my favorite.
Oh, nice.
I learned to ski there in Mighty Mountain Ski School when I was 4 years old, so haven't stopped 40-some years later, hating myself.
Well, for our ERP on Tap listeners, just so you know, we're in the kind of greater Sacramento area, and it's really nice because we're basically right at the base of Sierra Mountains, and we can drive and in an hour and a half be at Tahoe. So even though we don't get snow, we drive to the snow. So it's one of the perks. So good to hear you go to Kirkwood. That's fun. Tell me a little bit about Optimed and how it came about.
Absolutely. Yeah. So Optimed came about out of necessity over a decade ago when I was the COO and CFO at Precision Medical Products here in Northern California. And as a NetSuite customer, we were struggling with how to properly align our financials at a detail and clinical level to our accounting and all of the elements in our general ledger within NetSuite because of some of the elements that they didn't natively have within the platform for revenue cycle management, payment posting, things of that nature that are very important in medical billing. So we built it, and we built it then out of necessity, and then a couple more times other companies heard about it through the grapevine and said, hey, we could really use that, build it for us. And so we custom built the solution actually 4 times in 4 different iterations, if you will, and 4 similar companies, same medical billing vertical, but different segments with different products and or services. So we gained a lot of knowledge. And before we had the 5th time, we said, why don't we just build a SuiteApp? And that's how Optimed came to be.
That's great. Now, you obviously had options. I mean, you said you were on NetSuite already. So natural for you to think, hey, how can I make this better and work in NetSuite? But I mean, let's be honest, you had the ability to go, hey, let's go somewhere else. Why NetSuite? How'd you know that NetSuite was the platform to launch this on?
Yeah, great question. And NetSuite to me is the gold standard, especially when you're in M&A and you're looking at an exit. A lot of the big private equity and venture capital firms see NetSuite as a platform that's easily integrated to whether they're buying a solution or a company or an asset to be a platform company to put other holdings into, or if it's singular and just needs to be integrated into the overarching financials of the firm or the acquirer. NetSuite has always been the one that everybody sees and it adds value in a transaction, whether it's a value of synergies of how to easily integrate an acquisition or a divestiture, or if that can be leveraged as additional benefit to the acquiring company or entity.
Okay, that's good. Your solution came out at the same time that NetSuite was working on their own healthcare solution. A lot of people been waiting for that for a long time for various reasons. I mean, some people because HIPAA compliance, some people for whatever. I mean, lots of different reasons. Tell us what your solution is compared to just the NetSuite's new healthcare solution and Compliance 360. What's your solution specifically do?
Yeah, I'm glad you mentioned the HIPAA. That was a big hurdle, and one of the reasons that we didn't pursue making a company or building a SuiteApp earlier, because there was no HIPAA compliance unless you engaged with, say, a StrataKey or a third-party encryption gateway, which became cost prohibitive. And for us to put a solution out that has a cost and say, well, you also have to have this other solution that has an even more exorbitant cost for us to even, for ours to even work, then that just made no sense. So the Compliance 360, I was one of the biggest squeaky wheels. Like to believe that I had a role in pushing NetSuite in that direction. That, guys, you have to do this. If you ever want to grow in healthcare, you have to be HIPAA compliant, whether it's a simple BAA or something more robust. You need that. And so they came through with that. The Healthcare 360, I believe that they went a little too broad, and the missing element and the key and where the differentiator is and where we're a valued NetSuite partner and a solution that they recommend is because we focused on the revenue cycle management and the complexity in your GAAP accounting and your compliance 606 revenue recognition with regard to your bill charge versus your expected or your look back period realized collected at a detailed line level where you may have a claim that goes to an insurer or Medicare or wherever it may go that has one patient and 6 HCPCS or 6 CPT codes, essentially 6 items, services, and or products that may have been performed and or dispensed. And you need the ability to be able to, when you get an EOB back from that payer, and it says that we're paying lines 1, 3, and 5, and we're not paying 2 and 4. And by the way, on 1, we're paying 54%, and on 3, we're paying 26%, and on 5, we're paying 82%. You need to be able to capture your payments at that level as well. And so we focused on not just the structure needed for healthcare entities, whether it's a clinic or a larger network of healthcare providers in a clinical setting, or a durable medical equipment or home medical equipment manufacturer, distributor, or provider that's serving patients maybe in the field or at a location. Everybody's billing insurance. And that's the piece and the biggest gap and frustration, I think, with NetSuite customers in the past in healthcare is the inability to be able to do that revenue recognition, do your journal entry, manage your write-off period, and do it all within NetSuite and not have to do it in an Excel workbook.
So if you're in a conversation with someone in the healthcare industry, what's the buzzwords you're listening to? Because obviously this might be a fit for some and not for others. What is it that when you hear this, you're like, this is where I can fill in those gaps for you? What are you listening for?
Anytime I hear the acronym RCM, Revenue Cycle Management, in healthcare, I know exactly what they're speaking to. And that's our bread and butter and where we fit and where we originally built the solution out of necessity over a decade ago, unknowingly that it would be what it is and has become today as a solution for so many native within NetSuite.
That's
So
cool.
Our RCM, Revenue Cycle Management, healthcare billing, Medicare, commercial, workers' comp, you hear any of those terms, or the insurers, any of the names of the insurers and the complexities around the revenue recognition and or the payment posting elements that play into what you need to go through a proper audit or review, from a revenue recognition perspective. Those are the things that we know we can help.
That's great. Now I'm curious because as you're talking about as you built this, whenever you build, a solution, sometimes when it's first released, there's things that worked right away, some things that needed tweaking. What worked right? Let's start in a positive because I'm going to ask you what needed tweaking, but
Yep.
what worked right away? What was just out of the box? Boom, we nailed it.
Yeah, out of the box was the revenue recognition, the build to expected. In healthcare, you have a published global charge that you bill for a service or product. That's never, ever what you get pinned on, never. But in most channels, commercial work comp, you're not realizing that as your revenue. So you may bill 500 for a service, but your average reimbursement may be $350, right? Being able to understand and delineate that by insurer, by state, by insurance type, and all of those things have differentiating factors that go into that formulation and calculation of your aggregate number. We nailed that from a revenue recognition and ability to track on an invoice or a claim that went out what was billed, what we expect to get, what that difference is, which creates your reserve in your journal entry, and have that just be a seamless flowing solution.
Nice, nice. So was there anything that when it first came out, you're like, uh-oh, you got to tweak this? What needed adjusting?
The integrations to the different payment gateways and or billing platforms.
Okay.
Pipe delimited files and API connectors, and we probably went too broad and tried to, how do we get a widget that is 80/20? That's impossible with integrations. Our app is a great 80/20 solution that 100% of healthcare that bills insures and has the revenue cycle management requirements and revenue recognition requirements, 80% of it will fit them out of the box. The other 20 will be configured to their specific use case. Whereas in integration, one may be using Cerner and Dr. Kronos and Daisyville. Another might be using Brighttree and, Nico Health and whatever it may be. So trying to build a broad integration tool that, there's just so many differentiators between all the EMRs, EHRs, clearinghouses, billing platforms that we honed in and said, okay, the ones we have experience with and we would recommend and think are best in class, we'll build the native integrations with. The other ones, we can support a solution partner in building those integrations as part of the scope of work in an engagement.
All right. You mentioned being in the SuiteApp store. Tell us, there's a lot of people who want to develop their own SuiteApps. What? Just give us a little. I'm kind of curious. How is that process for you?
It's the reason I have no hair. No, just kidding. It was, and rightfully so, right? It's an Oracle product, NetSuite, and it's the Oracle BFN process built for NetSuite process that governs it. And they're making sure that it's not just anybody can throw an app in there, like an Android platform, right? So it is a stringent vetting process, very thorough, very detailed, a lot of work, a lot of effort, a lot of resources, but well worth it because we're proud of that status and the ability to go to a customer and say, we're a built for NetSuite solution that is native within NetSuite. You don't have to leave your environment at any time. Everything lives within NetSuite. That was important to us.
When it comes to this whole thing, what do you think is the part that obviously there's a lot of customers who we've just been hearing more and more people that are loving it. What do you think? What's the one part you're hearing over and over again? The part of Optimed that you think most of your customers brag about?
I think it's the team. It's David. It's Steven. It's Tim. It's myself. It's the team that's built the solution over the years and our experience that I really think the customers appreciate most. The solution is great and speaks for itself because it checks the boxes of what everybody has been looking for and seeking and needs to be able to properly go through that audit, recognize your revenue, and have everything live in NetSuite with your financials and your revenue cycle management and healthcare. But the experience, and I think that is another key differentiator in the NetSuite solution versus the Optimed solution. We've been living it for the last decade, breathing it in COO and CFO and CIO type of roles in these healthcare organizations, and building that solution as we've learned over a long period of time.
And by the way, good news. When I typed in the word healthcare into the SuiteApp store, finally I saw Optimed pop up. So that was just the word healthcare. That's good. And then I started adding healthcare billing, whatever, got a couple things. So that was
And
good.
they showed a slide in a recent prospect presentation where we were brought in as the recommended solution. And it's funny because it's the wheel, the NetSuite wheel of all the solution partners that have a app on the app platform. And when it says healthcare RCM, like it's a new category, and we were the only one there. So we're super
there you
proud of
go.
that. It's a great slide that we were like, okay, we're on to something here.
You're right. Okay. Yeah. Yeah. And when I typed in healthcare billing, it was the only one that popped up. So that was good. Well, I'll tell you what, that's really good to know. I'm kind of curious. You're someone who's always thinking of the next thing. What's on the horizon for Optimed?
Yeah, just putting everything back into the product. We've got to a great place where we scaled quickly. I mean, we're 15 months old and have had just a explosive response and put everything into ensuring that those early customers were implemented correctly and that they were happy and that the solution was scalable. So now we're at a place of working with our partners so that we can serve more customers and put all of our founder resources back into continuous improvement of the product and adding new elements, because with these initial early customers that we've had, we've learned so much more. So we have a product that's been 10 years in the making, and now we have another year that feels like 4 because of the exposure we've had to so many customers in different segments of healthcare that our brains are just going, we want to get back in and build more. So we're really excited to put more into the product and have future releases that incorporate a lot of the things we work that broaden the usefulness and value to different segments within healthcare.
That's awesome. That's awesome. Well, I'm excited about where you're going. I'm glad our Portello team gets a chance to work with you here and there, and run into you at lunch every once in a while. So that's kind of nice being in the same city. So thanks, man. Honestly, thanks for taking the time today to kind of give us even just that peek into what's going on over there, because it's exciting to see.
My pleasure. And we can't express our gratitude and value in the relationship with Portello and the partnership that we have. So thank you so much. Appreciate this opportunity.
Well, we appreciate you, and excited to see where Optimed's going. Listeners, what about you? Maybe if you're in the healthcare industry, maybe you know what RCM actually means. We're curious. What do you think of this? We'd love to hear from you. Please chime in, jump into the comments, and post what you think there. And of course, if you find value in ERP on Tap, of course, hit that like and subscribe button. We appreciate you so much. You're the ones who enable us to be able to do this. So we're excited to continue the conversation about all things NetSuite and Acumatica. Join us in our next episode on ERP on Tap.